why someone would develop rheumatoid arthritis? So in a healthy person, when you have a foreign invader, such as bacteria, viruses, or fungus, so your immune system is just like your country's army. You're going to fight. So all your body immune system will mobilize whatever uh, cells or substance that they have to defend your body against all these invaders. So in our country, you use gun or whatever, but in your immune system will mobilize, for example, white cells. It is a red cell, but the red cell is not usually involved in your defense system, the white cell. Then some white cell will produce antibodies. In medical term, we call it immunoglobulin. So all these are the body's the system that your body can use to defend your body against intruders. So in rheumatoid arthritis, it's an autoimmune disease. So what happened in autoimmune disease is that your immune system become dysfunctional. Then it mistake all these the cells, your body cells, as a foreign invader. So your body will mount an immune response to attack the cells lining your joint. So all these lining of joints, for example, this synovial lining here, when your body's immune system attack it, it becomes swollen and inflamed. So if you are existing patient with rheumatoid arthritis, the doctor may mention about synovium, where there's a tissue here, or it may say that it's a joint that have some fluid inside. Usually it will be fluid inside here. So in what happened will be this synovium will be the joint lining and become swollen, and when it's inflamed for a long period of time, we're going to erode the joint, and the joint will become deformed. But before it reach there, because of inflammation, your joint becomes swollen, tender to touch. When you press, it's painful, and because of this swelling, also becomes stiff in the morning. We know that the body's immune system is dysfunctional, but what actually causes it? We don't really know. A lot of research have been done to find the exact cause, but no conclusive cause, no. But we know that some patient may have certain gene that predispose them to develop rheumatoid arthritis. But having the gene alone may not, it doesn't mean that that person is going to develop rheumatoid arthritis. It needs to be, the onset of the disease need to be triggered by something else. For example, environmental factors, where the person may have that gene, but for many years never develop rheumatoid arthritis, then suddenly pick up the habit of smoking. Smoking is known to trigger rheumatoid arthritis in certain subset of patients. And some patients have very poor oral hygiene, which has certain bacteria will grow. And these bacteria can also trigger off a rheumatoid arthritis. So we also know that some patients develop rheumatoid arthritis after some viral or some bacterial infection. Then this family history, which probably related to the genetic predisposition. So if you have a family history of rheumatoid arthritis, there are higher risks that you may develop RA. But having said that, a lot of patients, in fact, develop rheumatoid arthritis do not have a family history. Then a lot of time we are talking about emotional stress, whether it's trigger off rheumatoid arthritis in those patients who has a genetic predisposition. So it's hard to definitely say that it does, but we know that in patients who had rheumatoid arthritis well controlled, sometime during a period of emotional stress, for example, divorce or some close family member pass away, some pet pass away, they do get a flare up now and then.